Hi, this is Dr. Michael Ryan answering the question, how does aging affect your veins? Well, one thing I want to clarify is the veins are different than the arteries, and artery aging is different than vein aging. Artery aging is something I certainly experienced as a cardiac surgeon, and the most common outcome of artery aging was what's called PAD, peripheral arterial disease. Another word for it is atherosclerosis or hardening of the arteries, which includes development of blockages in the arteries. And that those occur in specific patterns throughout the body and do occur more frequently as people age. And other things that can make it worse include smoking. That is different than vein aging. Vein aging is a different problem, and it's something that most certainly does happen. In fact, it's really clear that the risk of having a vein condition, like vein reflux is the most common one that we see, increases dramatically with age. So by the time people are in their 70s and 80s, two-thirds of the people in that age group have a vein condition. Many do not have any problems associated with it, and because it's not a dangerous condition, they can get by just fine. As the veins age, what happens is the vein itself is basically a tube, and that tube slowly stretches out. And so in the body, um, the typical changes as we age are that the amount of material in our tissues, which allows stretchy qualities like your skin being stretchy and resilient, is due to the amount of elastin in your tissues. As people age, the amount of elastin is decreasing, and so your tissues become less resilient. The same thing is going on in the veins. And so the veins become less resilient and they begin to distend or get larger. As they get larger, there's little tiny valves inside the veins that are no longer able to touch and prevent the blood from rushing back down the leg. So those valves get pulled apart as the vein gets bigger. And so the march of time, with the sagging of lines and the dilating of veins, persists. So with that comes symptoms for many people, but also visible veins, most commonly spider veins, blue veins, varicose veins are less common, but those are all side effects of this problem of the vein enlarging and getting stretched out. None of this is dangerous. None of this is life-threatening. People worry, is there a risk of blood clots? Am I going to keel over and die? The answer is no. The risk of blood clots is not increased as veins age. The risk of keeling over and dying is not worsened as your veins age, and you're not going to get a heart attack or lose your leg. Nothing like that happens with this condition. Conditions of the arteries is different. People can get more serious consequences of aging arteries, and people can lose a leg with aging arteries. They can, you know, die from complications of their artery circulation in their legs, but not with veins. So Dr. Michael Ryan answering the question of what happens when veins age.